Well, I was born and raised right here in Binghamton, New York. I've lived here almost my entire life, except for a couple of years being away at medical school. I went into family medicine immediately because it was the best specialty I could find that combined patient care along with procedures, which I loved to do. And I went out into rural practice where I could do obstetrics and minor surgery and see all walks of life. And I practiced out there for 20 years before rejoining the residency program. Although I did some part-time teaching while I was working in the Windsor office. I would come back to the residency, do some precepting. I had residents come to my office to see obstetrics patients, ones that were interested in getting more obstetrics training. They would come to my office and see patients with me, and then I would share in the delivery. So it really got me interested in teaching. So when the opportunity arose for the director position, I jumped at it because I want to produce the next generation of family doctors to go out and take care of the patients in this community, which I love. Our program is very diverse, as all family medicine programs are, but I think we have some innovative projects that we've done over the years. We've incorporated acupuncture and osteopathic medicine into the program, which gives it a more holistic approach, which the residents really enjoy taking part in. And we have a very dynamic group of faculty for teaching the residents. They all have their own little niche and specialty area, and it creates a very diverse program. So you get a very well-rounded training while you're here, both inpatient and outpatient. We're strong in the inpatient side with our hospital here, United Health Services, which has quite a large volume of a diverse pathology, a diverse patient mix that you'll see. So you get a really good inpatient training. The experience in the outpatient clinic that we have, where our faculty see our patients alongside of you, makes the practice much more diverse. We see a very well-educated number of patients, but we also have a lower socioeconomic status and underserved population that the residents take care of. So it makes for a good mix. I think one of the highlights of our program here is that you have a small community that you're working in, but we have a great hospital here that has both, or all the features that you want to get in your training. We have a NICU, we have a level 2 trauma center, we have neurosurgery, orthopedic surgery. So you're going to get a very broad mix of hospital experience, which you're going to want to see, but you're working in a small community that's friendly, people all know each other. You're going to know the specialists that you're sending your patients to. You know, you refer them to the cardiologist. It's probably going to be a cardiologist you worked with and that you know. You'll be able to call them on their cell phone and go over the case with them. So you have the best of both worlds. You have the high-tech, large medical institution, but you also have the small community that's going to be friendly, great place to live, wonderful environment here, and you're going to get a really good training.